Okay, so I have not made a video in a long time, so back from the dead. The coronavirus didn't kill me. But that's kind of what this video is about. My thoughts on the coronavirus, and it's probably going to trigger a lot of people, stir up some crazy comments, but this is just speculation and using a lot of math and numbers to support my point. So number one, I think the media is going way out of hand with this coronavirus outbreak and trying to just cause hysteria because first of all, I forgot one of the news stations, they already got caught using exaggerated photos here in the US from hospitals in Italy and then tried to say New York hospitals overloaded. They got caught, they got in trouble. Number two, they keep talking about how hospitals are extremely overwhelmed and they're like war zones. And some guy went out and he filmed the hospitals and they were perfectly calm, no mass crowds, nothing. So they are just trying to sensationalize this whole thing because there's nothing really going on in the world. Remember when, there was the possible talk of like World War III? That was the whole meme in January. News comes across that's more outrageous, I guess, and act like it never happened. They do it with every news cycle. So, something will be going on, and then boom, there's like a school mass shooting. Boom. Previous topic, totally forgotten. Well, guess what? There's nothing really going on in the world right now, so that's all they can talk about is the coronavirus. So, I mean, if, say, like, some building got blown up, or a nuke accidentally went off, or there was another mass shooting, which is kind of hard, would be hard to do now because everybody's locked up. But if just some crazy thing happened, or maybe like a tsunami wiped out like a major city, the news is just going to forget coronavirus is even going on. So I will acknowledge and say that it seems like the spread rate of the coronavirus is a lot more contagious and easier to spread than the flu. Now, saying that, the death rate of the coronavirus is not as high as everybody thinks it is. So the flu kills about, there's like a big margin of error room. So some say 40,000, some say like 65,000, just because they don't exactly track flu. Sometimes they relate it to pneumonia and they count that as a death toll for pneumonia, but that came from the flu. So, on average, it seems like based on statistics, you can look it up, the average death rate for the normal seasonal flu in the USA is about 60,000 people. So that's 60,000. As of making this video on March 31st, there's still less than 3,000 total deaths in the US. 3,000, 60,000, 3,000, 60,000. That's year after year. Every single year in a row, 60,000 people die from the flu. And almost, I think it's like a few million, not a few million, I forgot the numbers, but I think it was like, again, I don't know, I don't want to say anything I don't know, but I know it's multiple millions, like somewhere between 10 and 100 million, maybe more, get the flu. So again, that's an every year thing too. It's not like, oh, only 60,000 people have died from the flu in the past, like, how many years? No, it's literally every single year. This coronavirus thing, so far, one-time thing, and it's only killed 3,000 people. And again, the flu, 60,000, 120,000, 180,000, 240,000. Like, you just look at that year after year, and you just keep going back. That's the normal flu, and that's with vaccines. That's with the flu shot existing. And we don't even have a vaccine on the coronavirus. And yet the death count is so freaking low compared to the normal flu. And I know a lot of people talk about how when you talk about confirmed cases versus the death of actual confirmed cases of the coronavirus, the death rate is a lot higher with the coronavirus than the flu. Yes, that's the case because the sample size is a lot smaller. But as the sample size increases, the death rate will decrease. And it's also a lot lower than what they're currently showing because you have to also think about asymptomatic people that have not gone to the doctor, or people that don't have insurance. Because guess what? I'm a millennial. Ha ha ha. Yeah, boomers make all your millennial jokes. Most of us don't have health insurance. All of my friends, if I say, when's the last time you went to the doctor for a checkup? Or when's the last time you had the flu and you went to the doctor? All of them will say, I don't have insurance. I just wait it out. I'm not going to the ER unless it's life-threatening. So guess what? You're discounting all of these young people that don't go to the doctor because they don't have insurance, or they can just tough it out, or they don't like the doctor because they have anxiety, which is a totally different topic for another day. But yeah, so the death rate is super small. And then also, currently, based on actual statistics, and again, this is not even counting the people that just stay at home who had the coronavirus and didn't even know it, and they just thought, I feel like crap, I'm just gonna chill out for a few days. The death rate for people 49 and under, and then it goes down in age brackets, is 0.2%. 0.2. So yes, it does affect most of the elderly, and then there's chunks. And yes, obviously 0.2% of hundreds of thousands of people is going to be a big number, and the media likes to latch onto it. But again, if you're young, the rate is 0.2. And then you have underlying health conditions, which it seems like most Americans have. Like, let's face it, it's a very unhealthy country. That's my cat, Sunny. So it was like, I think what I saw on the bar graph, it was like 14% died because they had cardiovascular disease, and then there was like hypertension on there, and then diabetes, and they were like 6-7%, whatever. But if you had no underlying health conditions, it was a 0.9% chance of death. So if you're young and you have no underlying health conditions, then that's 0.9% of 0.2%, which when you do the math on the decimals, I'm not going to do it exactly, but I think it's like 0.00018, but just round and say 0.00002, something like that. So yeah, it's 0 with a bunch of 0 decimals too. And that's even if you get it. That's if you get infected. So, I mean, if you're just washing your hands and you're not touching your face and you're staying away from other people that are sick, then it's very unlikely you'll get it. So a lot of people just get a slight cough, and then they just kind of feel a little crappy, and then they get over it in a few days if you have an amazing immune system. So the big thing about this is having a strong immune system. So I know everyone's freaking out about coronavirus. All these people are dying. Well, I'm not trying to like be insensitive, because I mean, a life lost is obviously, that's really bad, and that's somebody's family member. But there's also a high chance that those people dying from the coronavirus probably could have died from the flu, or most likely they were going to die from the flu. I mean, if you even give it a few years based on probability, after a few years, they're probably going to die of the flu or some type of infection anyways. So, I mean, there's that. So then the other thing, when people say, oh, what about this young person who died that didn't have underlying health conditions? They didn't have any medical records of issues, and they were like 23 years old. Guess what? Again, us millennials, most of us don't have health insurance. We don't know if we have underlying health conditions. That's when they get admitted to the hospital, if they have underlying health conditions. But if you have no medical records, or you're like half of my friends who are like, oh, I haven't been to the doctor in 6 years, then you don't know if you have underlying health condition. Like, okay, I'm 28. If I asked most of my friends under 30, if I said, hey, what's your blood pressure? They would say, I don't know. I don't check it. Don't remember. Don't pay attention. If I said, what's your A1C, or your fasting blood glucose, or anything like that related to diabetes or blood sugars, they'd probably say, I don't even know what that is. Like, I'm just saying, here on the millennial battlefield, most people in my age range, they don't know if they have cardiovascular disease. They don't even know if they could have cancer. They don't know what their blood pressure is. They don't know what their A1C is. The only reason I know mine is because I have decent insurance and I've gotten it checked. Because, I mean, thankfully I was privileged enough to come from a military family that really emphasized on having health insurance. And so, yeah, but I actually have slightly elevated hypertension. So that's kind of what does worry me about the coronavirus. So I am spending a lot of time trying to eat healthy, diet, doing a lot of ketogenic whole foods diets with intermittent fasting, have some pumpkin seeds, raspberries, like here and there for vitamin C, broccoli, kale, cauliflower, avocados, been eating a lot of like whole good red meats. So, grass-fed beef, love it. Bison, wild-caught salmon, because here in Oregon, they're flopping out of the rivers everywhere. So I get wild salmon, like, it's not hard to get. Shellfish, like oysters, mussels, clams, all of that is very good. Now, another thing that a lot of people aren't talking about when it comes to the immune system is vitamin D. So notice how this flu outbreak and most flu outbreaks happen typically around wintertime. That's because vitamin D levels are low in people. Most Americans are deficient in vitamin D, period. And I'm not trying to generalize why it broke out so fast in Asia, but I do know that there's like a big thing against being out in the sun, wear umbrellas, wear wide hats, stuff like that. So, I'm assuming that most higher up people, though, in Asia are vitamin D deficient. You don't know until you check your blood. And then I know there's the argument that, it's in all the multiple hemispheres. But again, most people are vitamin D deficient anyways because people don't go outside, even in the summer. So I've been taking vitamin D3 supplements. I try to get exposed to the sun when I can, which again is very hard this time of year in Oregon. And so vitamin C, vitamin D, very good for the immune system. Obviously, lowering your body weight. Look at this. It's so weird. So I've been doing that. And you need to try to keep your blood glucose down and stable because high blood sugar is extremely toxic. They fry your white blood cells. They pretty much inhibit your immune system. They prevent the absorption of vitamin C, zinc, and all of those others. They deplete minerals. And guess what is also important besides vitamin D and the immune system and everything? You need zinc. Zinc is also very important, and most people don't get zinc because people are eating processed foods, which depletes your body from zinc, and zinc's extremely important in the immune system. So more seafood is good. And I think it was, I know it's not the coronavirus, but it's related to SARS, which the coronavirus is actually coming from SARS. There's a type of SARS. That's the actual virus for the coronavirus. Coronavirus or COVID-19 is the actual disease and sickness that you get, not the actual particle. That's actually a form of the SARS virus. So SARS, in most other cases, when they've done studies, have shown 90% of the people who had it were vitamin D deficient. A lot of old people in nursing homes, they're not outside getting vitamin D. It's also a lot harder to absorb vitamin D and make vitamin D the older you get. So that explains a little bit of the elderly side. Plus, they usually have other health problems. But again, I'm addressing other young people out there that the media is overreacting and you need to boost your immune system. So stop smoking because this does attack your lungs. And I actually have asthma and a few other autoimmune diseases, but I don't really get sick that much because I really try to boost my immune system to compensate. So, I don't know if you guys knew, but like 95% of asthma cases can actually be treated just with vitamin D, and that's why vitamin D and asthma are so like flip-flop between each other. If you actually look it up, asthma attacks are down in the summer when people are outside more getting vitamin D. So I haven't had to use my inhaler at all since taking vitamin D supplements, not once. Very interesting because I've had pretty much asthma and I had to use an inhaler even since elementary school. So you really need to try to get your stuff under control. Like if you have cancer, obviously that's a whole different topic about trying to treat that and deal with that, and then that's not 100% successful. But you need to keep blood sugars down and stable. You need to keep your blood pressure down, which I'm trying to work on because I did gain a little bit of weight, and that's just helped with my overall high blood pressure because that runs in the family, so I'm more susceptible to it. So I really need to pay attention to diet, and I haven't really been exercising as much because, again, it rains every day here in Portland, and I'm not really a gym person. So, boost your immune system, take care of yourself, and so if you do get infected, then you won't have to go to the hospital. You'll probably just get over it. Honestly, I think I may have gotten it in late February when I was in Las Vegas anyways, because it was one of the crappiest times that I have felt ever in years and years. Like I couldn't even eat my favorite foods. Like I had no taste in my mouth. I was just like blah. I felt like crap. I was weak. I was shaky, but I was able to get over it pretty fast. I think I was coughing a lot. I don't really remember. I was in the middle of a crazy road trip, so there was that. But again, I don't really get sick at all. So, I mean, something must have hit me pretty hard to cause that. But again, even with autoimmune issues and everything, I still try to take care of my immune system, because that's the most important thing in this case, because most likely everyone's going to get exposed. You look at all of these graphs, flatten the curve. The whole reason for social distancing is because they don't want everybody to get sick at once, and then the people who do have underlying health conditions and the elderly flooding the hospitals, and it overloads the healthcare system. So pretty much they want to try to just spread everybody out. Everyone's going to get coronavirus, most likely. They're going to be exposed to it. They just don't want everybody to get it at once. So a lot of people out there thinking, oh, if we're going to save lives. And I mean, you know, obviously if there's a bed open at a hospital and they have ventilators, then you're going to probably get your life saved. But people are thinking, oh, if I just stay home and I quarantine myself, I'm never going to get the virus. Like, guess what? You're probably going to get exposed to it, especially considering how it can live on surfaces for such a long time, and how it's spreadable, and how some people carry it and don't even have the symptoms at first. So it's pretty much like a wildfire disease, so you should probably start strengthening your immune system right now. But it is very interesting how the media is going all over the place with this and hyping it up and causing panic. People are buying toilet paper. People are just getting all this crazy stuff. They're acting stupid. A lot of people are buying junk food. Why would you buy junk food and like wheat thins and beers and everything to weaken your immune system when this thing's going around killing people? Like, are you just trying to kill yourself? Like, if anything, you should be trying to eat healthy at any time in your life. Right now, for humanity, is probably the time that you need to eat healthy and strengthen your immune system. And then on top of like nutrition and all that, you really need to get cortisol and stress like under control, because stress and cortisol really weakens your immune system. That's actually why I'm abstaining from doing long-term water fasts, because short-term, if you do a water fast, probably over 48 hours, which I would like to do 3-day water fasts, your cortisol goes up. I mean, obviously when you break your fast, it goes down, but still it gets heightened. So intermittent fasting is fine, but doing long-term extended fasts, probably not the best thing to do, just to be safe. But yeah, like I said, you want to keep your cortisol down, and you want to get a lot of sleep. Also very important for the immune system. So please stop stressing out, get some sleep, eat right, wash your hands, stay away from other people who are sick, try not to touch a bunch of things, and definitely don't touch your face, and get some sunlight if the sun is out, and you know, just take care of yourself. But that's the best thing that you can do. And I mean, it's weird how like the government is using this though as an opportunity to completely flex their powers and see what they can do to shut everything down. It's just weird. Normal flu kills everybody. Like, not everybody. It kills 60,000 people every single year, year after year, even with the vaccine. And they do nothing to shut it down. And then they jump on this while the media is going crazy and start shutting down local parks. They shut down restaurants. It's almost like they want to flex their power and see what they can do and see how much people are willing to accept it. So it's kind of a scary gray line. And I feel like a lot of politicians are shutting down their states just to avoid media backlash, because let's face it, the media pretty much runs this country for the most part. So they're just doing it to look good, even if the governors don't agree with it. I mean, for example, in Alabama, their governor didn't want to do a lockdown, and everyone just went off on her. So everyone's just shutting down their states based on peer pressure. So there's that. And if you look at Sweden right now, Sweden, no government lockdowns, nothing. They're just saying it's voluntary. If you're old, if you have an immune disease, you know, stay away from people, stay home. Business is open as usual. Restaurants are open. Everything is normal in Sweden, and their infection rate and death rate is almost the same as every other country. So it seems like the lockdowns aren't really working, because somehow Sweden isn't having an issue with it. So you can look that up. You know, I'm not just spewing a bunch of stuff. Google it, look it up. You guys have computers, you guys have smartphones, hence how you're watching this video. Anyways, hopefully I'll make more videos on this channel, and I just wanted to share my thoughts about how everyone is overreacting and there probably shouldn't be lockdowns based on the coronavirus because the death rate is maybe a little bit more than the flu. Some people are saying it could actually be less than the common cold, but again, you don't know until you test everyone, because there's probably a lot of people out there that have had the flu and they have antibodies, but they just never went to go get it documented because their immune systems were not completely fried. And yes, you can have a crappy immune system if you're young, because young people do stupid stuff to their health a lot. Anyways, subscribe, and thank you for watching this, and leave comments what you think. Argue with me, fight with me, do whatever you want, but provide some evidence, and let's have a debate in the comments. Thank you, and I hope you watch this, guys, in 4K, because I got a 4K webcam.